There's about 170 million people that wear glasses or need glasses to be able to see in the United States. Now, an eye exam, there's three major portions to it. One is the eye health of it, to make sure that your eyes are healthy. Number two is to make sure you can see properly. Do you need glasses or you don't need glasses? And number three, how well do your eyes work together? Now, when you have an eye exam, there are many ways to tell that if you need glasses. The technology in eye doctors' offices are becoming amazingly sophisticated. So when you're seeing out of your glasses or contact lenses, you could see on a scale of 1 to 10, you could see a 10 or you could see a 7. With the new technology, you're going to see a 10 and you're going to see in high definition, because the technology for refraction to be able to see good out of your glasses or out of your contact lenses is so spectacular now and getting so much better because the software is getting better. But that's something you need to go to your eye doctor's office because they have that sophisticated equipment. In the eye doctor's office, if we talk about the eye health of the patient or the overall systemic health of the patient, there's over 250 systemic diseases that could be manifested through the eye. Many times the eye doctor is the first to diagnose that disease.
A comprehensive eye exam entails basically, I'd say, two significantly different parts. One is helping people see, and then the second is to make sure that people have healthy eyes and healthy bodies.
Diabetes is the #1 cause of blindness. And the #2 cause, it was a seminar, and they were saying, what's the #2 cause? And the #2 cause was people who don't wear glasses or contacts. Why? Because they don't get their eyes examined. And once you lose vision from eye disease, you're not going to get it back. So even if you see great, that doesn't make you immune to eye health difficulties. It certainly doesn't to systemic difficulties, some that we can see and catch early. So you need to see your optometrist every single year. What's good for the eyes is going to be good for the body.
Optometrists don't just do eye exams for the sake of glasses. I mean, much of what they do is medical. They often identify brain tumors years before other physicians. Optometrists have, in my experience, have identified serious conditions, not only associated with the brain, but serious conditions in terms of the vasculature, like diabetes, like coronary artery disease. They often have very advanced equipment in their office, and they are able to make diagnoses at a very high level. And so it's really not just about contact lenses and glasses.
The eyes are not just a window to the soul, as they say. It's a window to the body. And we're going to see things about the health of your body. And we can help catch things and explain things to you and give you good tips, because nowadays we know a lot more than we ever knew before about how to keep you healthy.
The eye really is a forward extension of the brain. And with relatively simple techniques, we can actually look at neural tissue, we can look at blood vessels in the eye, and so we can actually diagnose systemic diseases as well, in addition to ocular diseases. So an eye exam goes way beyond just glasses and contacts. It goes into screening of eye health, and in a lot of cases, screening of systemic health as well.
We can see changes inside the eye long before you may even have signs or symptoms of systemic disease.
We can actually look by just dilating the pupil or looking with our ophthalmoscopes or our imaging technologies directly at neural tissue. We can also look directly at blood vessels. No other part of the body can we look directly at blood vessels and see subtle damage or leakage to them. So the eye, even though it's a relatively small organ, it tells a tremendous amount about the overall health of the individual beyond their eye health.
We can see vascular issues. We can see neurological issues, retinal problems. The eye is the only place that we have visible blood vessels without tissue on top of it.
And we can see the earliest signs of diabetes within the eyes.
We can see changes in the blood vessels in the eye before the patient even knows that they have the disease.
You can actually see microhemorrhaging in the deep retinal layers and say, in 4 or 5 years, you're going to have diabetes. You have insulin resistance, but you can stop that. You can do certain things and you can actually get rid of that and you won't have diabetes.
Diabetes is exploding. It's epidemic proportions. In 1979, diabetes was down here. We saw it once in a while. In fact, we would find out about diabetes because the patient would tell us. Now it's here, and we're seeing healthy patients, seemingly healthy patients, come in, and they're not healthy, and they have diabetes. And we can see the signs of that disease inside their eyes way before there's any other signs or symptoms. We have some incredibly sophisticated technical instruments that can show tiny little changes in the back of the eye that are pre-diabetic to help us get that patient to their internist and to help them get to where they need to be so that they can get the treatment they need sooner than later.
We also can diagnose strokes by doing side vision tests, whether that be screening confrontation testing with our finger count testing or our automated visual field testing. It's not uncommon for us in my practice to diagnose patients who have had a neurologically silent stroke that they were completely unaware that they had, but when we did the automated visual field testing, we find it. And then that patient can be sent over to the neurologist, sent over to their vascular specialist, so that modifiable risk factors can be taken care of to prevent them from having a secondary stroke.
If you see a little plaque in the bifurcation of the vessels, that could tell you you're set up for a stroke. This thing could be in the brain for an infarction. And if that's the case, there are things you can do to stop that or help it out.
The optic nerve is truly a cranial nerve. It's an extension of the brain.
The retina itself, that's the thin layer in the back of your eye that lines the back of your eye, takes light energy, puts it to electrical energy, and it goes to the optic nerve, to the visual cortex. That's where you build your picture. So it's one and the same. It is the brain that we're looking at when we look in the back of the eye. And that optic nerve is the direct conduit to the brain. And you can see changes in that optic nerve which tell you something is going on. Something is not right, and you can pursue it and catch things early.
Like Parkinson's disease is actually manifesting very subtly in the eye as well. So because it is that forward extension of the brain, you can diagnose a lot of systemic things through a comprehensive eye exam.
The optic nerve is the first cranial nerve of the brain, and it comes directly from here to the back of the eye and lays flat on the back of the eye. If it's swelling, that means something could be pressing in on the visual tract right here. If so, that could be a tumor. I can't tell you how many optometrists discover tumors in the brain, maybe before it's too late. Tumors right in the center, which is on the thyroid. We catch that quite often, adenomas. Those things can be detected often through some changes in the optic nerve. Of course, cupping in the optic nerve, where you see it one year and it starts cupping in, that tells you this patient's heading for glaucoma, and you can stop it. You can stop it in its tracks, because a lot of damage is done before you start noticing vision loss. There's a lot of subtle vision loss that goes on before that. They say 40% of your neurological cells, or the retinal cells that go neurologically, are damaged before you ever can tell you're losing your peripheral vision in glaucoma. So those are the things you want to catch early. And there's also some studies coming out that certain types of exercise, even good nutrition, can help deter that, help keep that off, help for way down the road or not at all.
Well, optometry is uniquely positioned to take care of the booming older population that's coming down the pipeline as our baby boomers get into their older age groups, and as we get older, ocular diseases become much more prevalent.
The life expectancy is so much longer than it was even when I started 30 years ago, that diseases like macular degeneration are very age-related. A choroidal melanoma, for instance, is something that has to be taken care of immediately that can be fatal. Retinal detachments, if not detected right away, can lead to blindness. And then the more chronic disease like macular degeneration, we need to get it sooner than later, because there are preventative things that we can do for macular degeneration instead of just waiting until people need injections in their eyes.
But there are other things like, for instance, large vessel atherosclerotic disease, where you have buildup of cholesterol in the carotid arteries, or heart disease, which can actually pass debris up into the eye, and that leads to then a fuller investigation systemically.
And now we need to look at prevention and ways with nutrition and for people to take care of their eyes and protect their eyes way before they get the bad effects.
So you can catch things early and you can start lifestyle changes. And we've seen now, and there's a lot of research out there that, yeah, lifestyle changes make a huge difference in the health of your body.
Perhaps the strongest argument for the need for routine comprehensive eye examinations is that common eye diseases present in its earliest stages completely asymptomatic to the patient.
The eye is amazing. We could see the blood vessels at a very small level, capillary level. In the heart and the body, it's at a more of a macro level. In the eye, it's at a micro level. So we could see disease way before the PCP could see disease because of the capillaries in the eye. So we look at the eye, sometimes we see these little balloonings in the capillaries. Those are called microaneurysms. Microaneurysms means that you're at risk for getting diabetes. If you're at risk for diabetes, at that point you could change your lifestyle to decrease your risk for getting diabetes. What's going on in your eye is going on in the rest of your body. Blood vessels go through your whole body. They're not just in your heart, they're not just in your toes, they're not just in your arms or your fingers or your brain, they're in the eye. And we could see those blood vessels. That's the only place in the body we could see the blood vessels. And through the optometrist, because we're used to looking at blood vessels, we could detect systemic disease, vascular systemic disease, way before other doctors could detect it. Thank you for watching Open Your Eyes. Be sure to tune in for more informative episodes.